So, just when you thought that it was safe to go outside and take your mask off from the pandemic and get a breath of relief, we are back to a little more of the worry and the fears of the possibility of this pandemic having a surge. And I believe if it is at all going to happen, it's because we've relaxed on the restrictions of wearing masks and trying to use precaution about wearing masks indoors and no longer having to do that or having it as an option. And a lot of this comes at a time just before summer when people want to get ready for vacationing and going out to places that they were prohibited from going when things were really bad, when hospitalizations were rising. So, COVID-19 hospital admission deaths forecasted to rise in the U.S. for the first time in months. So, I believe this is coming at a time when people have gotten more relaxed and have accepted the fact that we're in a world where, yeah, you have to get tested, and yes, you might have to get checked out, but nobody's really looking like they're as scared anymore. It's become a reality that we're living in. And a lot of us may think that it's over with, and we've been told it's over with, but unfortunately, there are some people that may still be sick and they may be carrying the disease and passing it along to other people unsuspecting, you know, that others are sick. And so, there's more traveling. People are getting on planes. They're able to go places that they weren't able to before. And so this is probably something that was going to happen anyways, I would believe. So aerial metropolis, for the first time in months, daily hospitalization admission levels and new COVID-19 related deaths in the U.S. are both projected to increase over the next 4 weeks. So, according to the update forecast models used at the Center for Disease and Prevention. So, this does not look good, folks. And this is just coming just before the kids are getting out of school. So, the projected increases come after weeks of study of steady upticks that they are saying is happening in infections across the country. So, subsequent to the removal of masking requirements and mitigation measures in many states and cities. So, forecast now predicts that approximately 5,000 deaths will occur over the next 2 weeks. So, this is really scary. So, you don't want to be one of those people, I'm sure, in that 5,000. So, with Ohio, New York, and New Jersey projected to see the largest totals of daily deaths in the weeks to come because people live really close and there's a lot of people elbow to elbow on the streets. So we are still in the middle of a pandemic. So the pandemic never really was over. It was just where it was winding down, and it was how would you say, it's not over, but it's receding. That doesn't mean it hasn't come to a complete stop or halt. So it's still happening, but like it ran its course. But now you have people relaxing on the mask, relaxing on what rules they had in place, and that's no longer an issue for people to just take their mask off and walk around unmasked because people feel like this thing is over. Unfortunately, it isn't. So there's no confusion about that. Dr. Anthony Fauci, the nation's top doctor, infectious disease expert, told Foreign Policy last week. So the forecast models show that 42 states and territories in the hospital admission across the country, including New York, Minnesota, Wisconsin, Florida, are projected to see increases in the next 2 weeks. So those are the hot spots that are projected to see rise in COVID and it's probably the new one. It could be the old one. Well, we'll surely see. So nationally, a growing number of COVID-19 positive patients have already been admitted to the hospital, requiring care. Federal data shows. So this is the reason why they projected this to happen. So people are starting to go into the hospital for this again. So since late last month, daily hospital admission totals have been slowly increasing, particularly in the Northeast, according to the CDC data. And in the last week, admissions have jumped 20%, with the emergency department visits also up by 18%. So on average, more than 2,200 virus-positive Americans are entering the hospital each day. So this is now coming out right here, but I don't know if it's actually being talked about in the news because they've moved on. They've been told not to really talk about, the virus and COVID, pretty much to like move on with life and look to, other issues that are um, happy related or unvirus related issues. So that's what it looks like. It's almost like it's here, but you don't want to think about it right now. We have other things to worry about. So a total that has increased 20% in the last week. So this also marks the highest number of patients requiring care since mid-March. So this is what people don't want to see, but this is what we probably will have happen again, unfortunately. So it's a photo. It's a low-level inmate from the El Paso County Detention Facility who works loading bodies wrapped in plastic into the refrigerated temporary morgue trailer. So this is in the parking lot of medical examiner's office in the El Paso of Texas. And so there's a lot of bodies that are being loaded in there. And so although the totals remain significantly lower than during other parts of the pandemic, admission levels are now on the rise in every region of the country. So it's starting again, folks, unfortunately. So nationally, new infection rates have reached the highest point in nearly 2 months. So 60,000 new cases are being officially reported each day. So that's how they are up on this, and 27% in the last week, according to the CDC. So in Northeast, New York, New Jersey, the region, infection rates have risen to 64.8% and 54.8% respectively over the last 2 weeks. So since last summer, dozens of states have moved to shutter public testing sites, with more an at-home COVID-19 test now available. So they've got at-home tests so people can test like that. Most Americans are not reporting the results. So some people know that they might be positive, but they don't report it. And thus, experts say infection totals are likely to significantly be undercounted this time. So this time it'll be worse, even more worse, because there may be people who are positive and they're not admitting that they are, and they're going to work, or they're going, because some jobs, believe it or not, so you can't blame the people entirely, because some jobs will say even if you're positive you have to come to work in some job settings. So they'll allow you to come to work positive. And I know people go, what job does that, with all this testing going on? But there are some jobs that I've heard that allow people that test positive for COVID to come to work and come around people with it. And you can look it up yourself, but I heard also some schools have allowed teachers to come in with it, So I know people are saying, what? But but then I heard different stories where if you are positive, that they'll pay you, and even if you have to stay home, depending on how severe it is. But I guess it depends on the symptoms that you're having, and there's so much going on. But I would believe that might change if the numbers start to rise, and if it's what they're saying here, that those little things that they were doing, allowing people to come in positive and stuff, they're probably gonna like stop doing that because it'll get them in trouble. Because what people will say is that they're spreading it to other people, and this thing is never gonna go away. Well, it hasn't gone away anyways. So health experts say that the confluence of factors is likely to drive the nation's latest viral resurge, including easing the masking requires other COVID-19 restrictions, as well as highly contagious Omicron subvariants, which have been estimated to be about between 30 to 80% more transmissible than the original Omicron strain. So BA2 subvariant, BA2.12 and 1, the first discovered domestically last month, so in New York State, continues to steadily increase. In the U.S., newly released data shows this. So subvariant now accounts for 36.5%, and the new COVID-19 cases nationwide in the New York, New Jersey area, it accounts for a majority of 62%, which is it's rather high of new cases. And I guess all this is happening because nobody wants to talk about it anymore. So when you come back and look at these numbers, you're like, oh man, not this again. So the vaccine immunity waning and the presence of variants of growing concern. So, people have gotten vaccinated. The vaccinations probably are getting old now. And this disease has gotten smarter. It's like learns its way around the human body and how to get past the vaccine now. And so it's basically making copies off of itself, and it's getting smarter and smarter as fast as they're trying to make vaccine. This disease is just moving through body after body, learning us. Yeah, that's what it seems like. And it's like you know what, you're not gonna get rid of me. If it could talk, that's probably what it would be saying. But it says that they urge the public to get vaccinated still and boosted to prevent the risk of the severe disease. So they wanted you to get boosted. But I also heard that when you get boosted too many times, which some people got twice, and 3 and 4 times, that it overworks your immune system, which I'm thinking maybe that will make your immune system go in the reverse. Instead of making it stronger, could possibly make it weaker. Because now you've overworked it and it's just going to shut down, or maybe you'll get sick with this thing easier. I'm throwing it out as an assumption, so I'm not sure, so don't hold me to that one. But it says we hope that we don't see a major uptick in cases, but we get into the fall. As we get into the fall, please, but it remains to be seen. So we're going to have to wait to see, which is the reason why we're still encouraging people to get vaccinated. Fauci said this was last week, so if you've not gotten vaccinated, you should get vaccinated. And if you're eligible for a booster, it says make sure that you get it. And so, some people, I guess they're the new anti-vaxxers. And I say that lightly, because these are people who already got vaccinated when it was available, and then they got boosted, and they got all the shots, and then they came out with this 4th booster. I believe it was a 4th one or a 3rd one. I don't know. I lost count. But there are a lot of people say, I'm not getting boosted again. Forget it. I got all the boosting, all the shots that I needed. If we can't get rid of this thing, forget it. He ain't doing nothing but just, using us as pin cushions and lab experiments. But I know that's what some people in their minds, I thought about it too. I thought that, it might be like making us more sick, getting all these shots. But anyway, on to something else. I mean, we don't want to end up like this person, laid up in the hospital and you can't breathe and you're on a ventilator or intubated or whatever else happens, or maybe worse. And so we definitely don't want to end up like these people either, unfortunately. And a lot of that happened in 2020. It seemed like this one body after another, and you would think it would have taken its course, but it's learned our bodies and learned our immune systems that it's just making copies, and it's learning when we're vaccinated and when we're not.